Hi, I'm Renata. I'm Dr. Maney's patient care coordinator. Here are some of the questions you've asked, so we're going to go ahead and answer those today. Why do I weigh more after surgery than before surgery?
So the reason for that is even though, for example, with liposuction, we're removing tissue, fat, etc., you're getting a lot of fluid in. Your body is basically trying to figure out what to do with that fluid after surgery. And so part of the process is inflammation, swelling, etc. And so especially in that first week, your weight will fluctuate, your body will fluctuate, and that's completely normal. So don't be alarmed if you weigh more after surgery than before. I promise we did something.
Can a tummy tuck get rid of stretch marks?
So it depends on where the stretch marks are. So in general, with a tummy tuck, what we're doing is we're removing as much tissue as we safely can from that area, okay? And so in general, kind of the rule is around the level of your belly button and below is where we're removing tissue. Now, sometimes we're able to go above, sometimes we're not able to get all the way up there. And so if you've got stretch marks way up higher in your abdomen, odds are we're not able to remove that. But if it's in that lower area, then you can probably expect that to come off.
Are implants the only way to enhance breast?
So no, it depends on what your goals are and kind of what your body currently is at. So for example, if after having kids, breastfeeding, or massive weight loss, you notice that your breasts just don't sit as high as they used to, then sometimes just doing a breast lift where we go up, kind of get that perkier look is all you may need. For example, if you want just a little bit of volume, but you don't like the idea of implants, then sometimes a fat transfer is the way to go.
When do I have to have my implants replaced?
So a lot of people talk about 10 years, and all that's really referring to is not necessarily how long the implant lasts or when it has to be replaced. But in general, in studies, you look at when you start to have some of those issues with your implants. So for example, developing scar tissue around the implant, higher risk of it possibly rupturing, that sort of thing. And around 10 years where you start noticing an increased trend in it. Now, with that being said, if your implants look great, feel great, not giving you any issues, then you don't have to do anything. But if you start to notice some of those issues, then that's where you should talk about possibly getting your implants replaced.
Okay, nice. Where is the incision for breast augmentation and why?
So in general, I place the incision directly under the breast. And so it kind of goes in that fold such that whenever you're wearing a bikini, a bra, etc., it shouldn't be visible. Part of the reason for that is a couple of things. So that is one of the most reliable ways to make sure that the implant is in the position we want it to be in so that it's not, too far this way or too far up or etc. The other thing is, if you think about down the road where if you ever want your implant replaced, then any implant exchange or revision surgery is done through that under area of your breast. And so you're going to be going there at some point anyway.
Will I have drains for a mommy makeover and why?
It depends on what you're getting with your mommy makeover. In general, when I'm doing any of the breast procedures, so breast augmentation, breast lift with augmentation, I don't use drains. With the tummy tuck procedure, I do. And the reason for that is if you think about what we're doing with the tummy tuck, we're basically lifting up all of this skin, pulling it really tight, and then closing it down here. But we've created all of this space in your abdomen, okay? And so what the body will naturally do whenever it has a space is try to fill it with fluid, okay? And in general, your body is able to absorb a certain amount of fluid that's in these spaces. However, in that immediate period after surgery, especially when you combine it with liposuction, a lot of the inflammation and the fluid shifts after surgery, your body just can't keep up with it. And so the drains are there to basically help get that fluid out until your body's able to keep up with it. And so a lot of people will also ask, how long do my drains have to stay? And it really depends, because we only pull the drains once we feel confident that your body will be able to reabsorb that fluid.
Can I still get pregnant after a mommy makeover?
Yes, patients definitely can get pregnant after a mommy makeover. Now, the things to consider is the pregnancy changes that you had before your mommy makeover, you may have again if you get pregnant. So if you notice that you get some extra skin, a little bit of that separation coming back in your muscles, a little bit of your breast starting to sag a little bit, you can have all of those changes again.
Can I still breastfeed after a breast augmentation?
So in general, a breast augmentation will not affect the ability to breastfeed. However, some patients are at a decreased risk to begin with at being able to breastfeed. So that's just something to keep in mind.
Will I lose nipple sensation after a breast augmentation?
In general, no. So when we're doing a breast augmentation, I place the incision underneath the breast, so I'm not going through the nipple or anything like that. With that being said, if you think about what a breast augmentation is doing, you're adding a lot of volume behind the breast and behind the muscle. And so we're putting a lot of those nerves on stretch. And so throughout the recovery process, you'll notice you'll have weird nerve-like sensations, and they'll be sometimes here, etc. That's those nerves kind of reprogramming to accommodate having that implant there.
Where will my surgery be performed, and is the facility accredited?
Yes, so we perform all of our surgeries here at our South Lake location, and it is an accredited facility. With that being said, your post-op appointments will be at any one of our 5 office locations, depending on what's most convenient for you.
What will my mommy makeover scars look like, and how can I minimize them?
In general, it depends on what the mommy makeover entails. So we have a separate video all about the kind of procedures that we do with the mommy makeover. But if in general, most people are talking about your breasts or your tummy, and depending on what you're getting, you'll have either an incision underneath your breast or an incision around your nipple, down and underneath the breast. And then a tummy tuck scar will in general be at your lower waistline, hidden in a standard pair of underwear, and depending on how much extra tissue you have, it may extend slightly onto the back or connect to the back. As far as things you can do for these, it depends on how well you scar, whether you even need anything. We do have different creams, gels, etc. that can be used. We also offer to patients that have a tendency to form bad scars an injection that we do at 2, 4, and 6 weeks after surgery, completely included within the cost of surgery. And what that does is it helps decrease the chance of getting some of those hypertrophic scars, keloids, etc.
So that was it for the Q&A. Thanks for sending in your questions. If you have any other questions, you can send them over to Dr. Manny's Instagram at the Dr. Manny.